Hello everyone, today I'm going to go over how to use a virtual clean room and go through an example with you all. First you want to enter the garbing room where um, you're gonna garb up in the correct order in order to go into the IV room. You want to first remove your jewelry, followed by uh, putting on your shoe covers and crossing the line of demarcation. After this you want to put on your cap, your, your head cover, and then your face mask. Once this is done, wash your hands and forearms with soap and water for at least 30 seconds. And usually during this step, you will clean under your nails too with a nail pick. Once that's done, dry your hands with lint-free cloth and then don non-shedding lab gown. After this, you want to re-sanitize your hands by using an antiseptic and then donning your sterile gloves. So we gowned in correctly. Now we want to go into the clean room. Chemo rooms for chemo. Okay, so right here you can select the order that the IV order they want you to prepare, and over here is where you can find all of these supplies to compound that order. So let's go ahead and click an adult and find an order that's relevant to you guys right now. Let's go with pantoprazole. So they want 80 milligrams in a 80 ml IV bag of NS. Usually this comes in a 100 ml IV bag of NS. The reason they might have wrote it like this is because when you compound the 80 milligrams, it's in a powder, so you have to reconstitute it. And the amount to reconstitute would be 20 mLs. So 20 plus 80 would be 100 ml of NS. I even checked lexicon and it's right here, 80 milligrams and 100 ml. This is the way we do it in Kaiser as well. And usually with these orders, you get a label that prints out. It kind of looks like this. I couldn't find the pantoprazole one, but here's one with cefazolin. So you get the milligram amount and then in how much amount of fluid you want to put it into. So you want it into 100 ml NS. Okay, we got our order. Right here, if you click on view label, it'll show up the package insert label, and right here you can find like the steps to reconstitute and prepare this IV product. So if you search up like preparation, it should be there. So for example, the 80 milligrams in 80 ml of NS is right here. So each vial of pantoprazole comes in 40 milligrams, and each one you want to reconstitute it with 10 ml of normal saline, and then you want to put it into 80 ml of either D5 NS or lactated Rignor in order to get a total volume of 100 ml and get a final concentration of 0.8 milligrams per ml. So as you can see here, it tells you the steps to make this IV bag. So whatever medication you guys are doing, just go to this view label, and you should they should tell you how to make it there. So now that we're ready to compound, let's go ahead and grab the medications. So we need an 80 milligram amount of pantoprazole. So right here we have 40 milligram vials, so we're going to need to take 2. And the reason I'm doing pantoprazole is because it requires a reconstitution. So it's a little bit extra steps. As you can see, like other things over here, when it doesn't say requires reconstitution, they're easier since it's already in a liquid form. You just have to drop the dose and shoot it into the bag. Whereas pantoprazole, you have to reconstitute it with the diluent and then put it into the bag. So we got our 2 pantoprazole, 80 milligrams worth. Now we want to get our diluent. So you can either take 2 10 ml of NS, one for each 40 milligram vial, or you can get a 50 ml NS vial. We'll go with the two 10 mLs. After this, you want to get your IV supplies. So this includes your bag. So you want the IV bag enough for 80 milliliters of NS. So if you scroll down, you can use the 100 ml NS IV bag. So we take that. And you also want to grab a IV bag seal. Now that we got that, the only thing that we're missing are the syringes and the needles. So you go to syringe supplies. You grab yourself a syringe that is appropriate. So we're going to be drawing up 10 mLs and putting it into the pantoprazole, drawing it back up, and then putting it into the IV bag. So we want at least the 10 mLs. You can also use the 20 ml, but the more accurate it is, the better. So we're going to take two 10 mLs. And we want to take two needles as well. In real life, you would also take alcohol swabs, but these are not on the virtual clean room. Now that we got all our supplies, we're ready to compound. Now we just have to choose a hood. So usually the horizontal hood is used for non-chemos and the vertical hood is used for chemos. So we're going to click the horizontal hood. Okay, I tried to go through this cleaning step, but it wouldn't let me progress. There might be some like glitch or bug in the virtual clean room. So let's just assume that it's clean and enter the hood. Okay, so it's important to see where you're gonna place your products. You don't want to have it too close to you or too close to the vent. So you want to have it kind of in the middle, at least 6 inches from here and from here. So you want to have it here. Another important thing is to not place anything behind anything else, as this blocks the airflow that is preventing contamination. So as you can see here with the blue lines, it tells you where the airflow is going to be blocked. So nowhere here you want to put your stuff. So you want to put them at least an inch apart so that they maintain proper airflow and prevent contamination. So once we have everything down, we're ready to start. First step would be to remove the caps of all of the vials. So we're going to do that. And then you're going to alcohol swab anything that you're going to puncture. So that includes your IV bag, pantoprazole vials, and the normal saline diluent. Once the alcohol is dry, go ahead and grab a 10 ml syringe, attach the cap and the needle, uncap the needle, and you want to puncture the normal saline. Usually in practice, like whenever you're going to drop a liquid, you would put your syringe to whatever the amount of liquid that you're going to draw up. So for example, we're going to draw up 10 ml liquid. You would draw the syringe full of air up to 10 mLs and then push it in. And that'll make it easier to draw up the 10 ml of liquid. Sometimes when you don't do this, there could be a difference in pressure between in the vial. So that causes your syringe to push back up or sometimes even push back down. So now that we're ready, you want to drop the 10 mLs. And it's very important to note which line you're going to use. It is this first line that is the accurate measurement. So never use this line. It's going to be this top line, just like that. So we got our 10 mLs. Once we remove the liquid from the vial, let's go ahead and place it to the side so we don't worry about it. puncture the pantoprazole and push in the 10 ml. So you just want to push it all in. Okay, now here's where in real life you can swirl the vial in one hand and hold the syringe in the other hand. That way you don't have to put it back down and risk any contamination from the, the base of the hood. But in virtual clean room, it doesn't let you do that. So I'm just gonna place it back down just for demonstration purposes. And then you're gonna swirl it. And you grab it again, do the same steps, uncap the needle, puncture, and then you're gonna drop the 10 mLs. All right, perfect. Move the syringe. We're done with this, so we'll set it to the side. And you want to puncture your IV bag now and push in the 10 mLs. Move the syringe. In practice, at this step, you can just throw away the syringe into the sharps container, just because it's less of a risk for you to puncture yourself. Because if you recap the needle, there's more of a risk for you to puncture yourself. So you just throw away the whole syringe and needle into the sharps container. On virtual clean room, it doesn't let you do this, unfortunately. So we're gonna have to cap it and then do it separately. So we cap it, we detach the needle, throw away your syringe into the trash, and the needle into the sharps container. And usually by trash, if there's any like trace medication in the syringe, you would have a specific bin for it. It wouldn't just be like a regular trash. It would be a bin for any like trace medication things. So now that 40 milligrams is in the bag, we would do the next 40 milligrams. So we're just going to repeat the steps. Again, very important. Don't put the stopper like this. It has to be on the this first black line. That's where it measures it accurately. Place this here. Once we're done with it, go ahead and puncture the pantoprazole and push in the 10 ml. Move the syringe. You go ahead and swirl it. Swirl that. And we'll grab it, uncap it again, puncture it, and invert it. Drop the 10 ml. Okay, we're done with this vial. Set it to the side. Go ahead and puncture your IV bag and push in the 10 ml. Okay, we're done with that. Go ahead and throw the syringe into and the needle into the sharps container. Trash that and this into the sharps. Your bag is ready, so we're gonna go ahead and pick up the bag and seal it. So usually in most medications that aren't like a high alert or chemo or that are titratable, you don't really need to worry about the overfill. So as you can see, like I didn't take out the 20 ml to get the 80 ml of NS in this IV bag. I just shot in the 20 ml extra into here, and the concentration would be a little different, but it's not as significant in these non-high alert medications. But if you did want to make it exact volume, then you would just subtract the 20 ml from the NS bag, so that you can put in the 20 ml of the reconstituted product in here and get the exact concentration. So we're done with that. It's ready to be checked. As long as you signed it, you put the label on it. Go ahead and put it through the pass-through for the pharmacist to check. And see, we did it correctly. You get your check marks and you're good to go. Now we're just gonna exit. That's all. I hope this was helpful for you guys.